About disinfection of endocavity ultrasound probes, the risks and how to prevent them. And I will skip some of the slides in the interest of time. So this is the famous iceberg of Dr. Weinstein from Chicago. It shows that about 80% of healthcare-associated infections come from a patient's own flora, but that infections go from patient to patient by hands or by devices. And he estimated that about 20 to 40% of infections in healthcare went patient to patient. So we know that infections go patient to patient. They go either on the hands of healthcare providers because they don't perform hand hygiene, or they go from the contaminated surface environment, or from inadequately disinfected or cleaned medical devices, thermometer, endocavity probes, endoscopes. So how should we disinfect or sterilize devices? Well, this was described very well many years ago by E.H. Spalding, who believed that how an object will be disinfected depended on the object's intended use. This scheme has been modernized since then, but we still follow it. He described critical objects. Those are objects which enter normal sterile tissues or the vascular system, or through which blood flows, and they should be sterile, and this would include surgical instruments. Semi-critical devices are objects that touch mucous membranes or skin that is not intact, and these require high-level disinfection. This will kill all microorganisms, with the exception of high numbers of bacterial spores. And endoscopes would be an example, or for that matter, endocavity probes. Non-critical items are objects that only touch intact skin, such as a blood pressure cuff, and they only require low-level disinfection. Well, this is a scheme that describes that, how to prevent infections. We have a colonized or infected patient. We get transmission from hands or inanimate surfaces, including medical and surgical instruments, an infectious dose, and a susceptible host, and we have transmission. We interrupt transmission by hands, by hand hygiene, and we interrupt transmission by contaminated medical and surgical instruments by cleaning, disinfection, and/or sterilization. As we talk then further about sterilization and disinfection, we have to realize that not all microbes are created equal. Some are more susceptible to disinfectants and sterilants than others. The ones that are easy to disinfect and activate, kill, I put in green. The ones that are more difficult to inactivate, I put in red. So envelope viruses such as herpes are the easiest. Gram-positive bacteria such as staph, strep are next. Gram-negative bacilli are a little harder, things like E. coli, Klebsiella, and Enterobacter. Non-envelope viruses are quite hardy in the environment, will last for days to weeks in the environment. They include norovirus, the main cause of gastroenteritis worldwide, and of course HPV, a major cancer-forming virus of which all of you are familiar. The most resistant organisms are bacterial spores, such as C. difficile. Let me elaborate on semi-critical items. Again, these come into contact with mucous membranes. The object is that they should be free of all microorganisms except for some residual bacterial spores. The germicides, therefore, have to kill all microorganisms, such as mycobacteria, all viruses, including non-enveloped viruses, but may not kill large numbers of spores. And examples include endoscopes, respiratory therapy equipment. But in addition, you can see items that have more interest to you, such as endocavity probes, diaphragm fritting rings, and others. And they should be high-level disinfected. This is a typical, of course, endocavity probe. Well, the probes are quite widely used in medicine. Obviously, vaginal and rectal probes are used in sonography scanning. You're all familiar with that. Transesophageal echocardiography probes are used for echocardiograms of the heart, and they're more sensitive than our transthoracic. In the United States, the guideline, the CDC guideline, of which I was a co-author, is that is the Centers for Disease Control and Prevention. Endocavity probes with contact with mucous membranes are considered semi-critical and require high-level disinfection. Even if a condom or probe cover is used, the guideline still says that they should be high-level disinfected, and that's because depending upon the study in which you read, up to 80% of condoms or probe covers fail. That is, they still leave residual contamination on the probe. However, as you know, some countries do continue to recommend low-level disinfection with the use of a probe cover. However, the evidence would suggest that this is not safe for our patients. There are many examples. We know that depending upon the manufacturer, that transvaginal probe covers can have failure rates as high as 65%, depending upon the manufacturer, even before they're used. An even higher number of probe covers will fail after use. We know that condoms are superior to probe covers in general for ultrasound probes in one study, but again, still 2% of the covers had led to contamination of the underlying probe. Now, classically, we've achieved high-level disinfection with chemicals, principally glutaraldehyde. It's certainly quite effective when used properly. All of these require 8 to 30 minutes of immersion time. We do not recommend in the United States just wiping them because failure to cover all the surfaces, so they should be immersed. And then, since many of these substances are caustic, they then require rinsing and drying. One can also use things such as orthoaldehyde, which has a 12-minute claim in the United States, and a variety of other chemicals. So, high-level disinfection is what's recommended in the US and much of the world for all semi-critical items. In many places, only low-level disinfection is used. So, why am I telling you that we should use high-level disinfection? Well, there are a whole variety of studies. CAC showed that 5% of exams, this is transvaginal ultrasound or transrectal ultrasound, despite using probe covers, 5% of them were contaminated. MON 2012 showed that transvaginal ultrasound, this is after use of a probe cover and low-level disinfection, they could detect HPV DNA 7.5% of the time. Castellagno, again, after probe cover removal and low-level disinfection, they found HPV 4% of the time. Mazzelli looked at the same thing, again, 2014, after the probe cover was removed and low-level disinfection. HPV was found 13% of the time. Again, they also found 20% of the time C. trichomatis. He found Staph aureus 4% of the time. So it's not just viruses we're finding, but bacteria as well, and a substantial number of cases, and despite the use of probe covers and low-level disinfection, which is why in the United States and many other countries, high-level disinfection is recommended. Of course, there's limited data on what the risk is to patients, because many of these patients are going to present weeks, months, years later with an infection. Most of these agents will be sexually transmitted type disease agents in general, and therefore they're ascribed to a typical STD. But we do have examples, and I'll just show you one case report of actual molecular data showing transmission. So patient A had a transvaginal ultrasound in May and again in September. In both cases, there were patients who followed that patient. Again, the transvaginal ultrasounds were low-level disinfectant and had probe covers. Both of these patients, subsequent patients, were HCV negative. Both became HCV positive. And by molecular sequence analysis, genotyping, they had the same HCV type as patient A. This is one of just several case reports and small outbreaks in the literature. So I'm sure, again, this using the iceberg, this is the tip of the iceberg, and it's due to how difficult it is to ascertain these infections. We did a modeling study using some of the data I showed you, and in France, it would be estimated in 1 year that there could be as many as 1,500 hepatitis B infections, 8 to 15,000 HPV infections due to use of low-level disinfection with probes. So, classic high-level disinfection methods are difficult. If they don't rinse the objects from the chemicals, such as glutaraldehyde, they cause burns and mucous membranes. The residual may appear oocytes for in vitro fertilization. They're dangerous to the staff and toxic to the environment, and they can damage probes. So, what are the newer methods? Well, we have ultraviolet light, which antigermics, very fast, no chemicals and automatic, and you have vaporized hydrogen peroxide that's available in some countries. Many societies, US, Canada, Australia, are already recommending high-level disinfection. Others, like the UK, Germany, France, are likely to recommend it in the near future. So I'm just going to do just 2 more slides to introduce the idea of using UVC. For those of you that are interested, please see my colleagues at the Germatech booth directly outside here. UV light damages nucleic acid and destroys the ability of bacteria viruses to replicate. The characteristic wavelength is 250 nanometers. It's idle for both vegetative bacteria and spores, although requires a higher concentration, higher intensity for that. It's very fast, and it's been widely used in the food industry for years. This is the device, the antigermics, that you hang the probe in and essentially surrounds it with UV light of high intensity and provides a very rapid, high-level disinfection. So on my last slide, why use UV light versus chemicals? It's broad-spectrum activity, but so do the chemicals. Unlike chemicals, it's residual-free, easy to use, hang the probe, you don't even have to disconnect it, close the door, push the button. Safe in the environment, safe for probes. There's no residual, therefore there's no damage to gametes or others. It's safe for the users. Very rapid, 90 seconds to 2 minutes. All the monitoring is self-contained, and it gives you a readout. The device is immediately ready for use after disinfection, doesn't require any wrapping, any rinsing, and there are no consumables. So with that, thank you very much, and if you have more questions, please see my colleagues at the Germatech booth. Thank you.